How to tell if you have a pelvic floor issue versus, say, a low back issue. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Today, I'm going to share with you this Kosean questionnaire. It's 10 statements or questions on it, and I want you to follow along. This will help you determine if you do have some possible pelvic floor issues. So what you're going to do is just keep tracking either on your fingers or in your head, or grab a piece of paper and a pen. And what you're going to keep track of is how many of these statements are true for you. So let's get started. There's 10 statements, and at the end, I'm going to tell you what it means. Okay. So number one, I sometimes have pelvic pain in my genitals, perineum, pubic or bladder area, or pain when urinating that is more than a 3 on a 1 to 10 pain scale, with 10 being the most pain imaginable. Number two, I can remember falling onto my tailbone, my lower back, or my buttocks, even if it's been a long time ago when I was a child. Number three, I sometimes experience one or more of the following urinary symptoms. So there's several of these, just keep track. If you answer yes to any of these, it's just a one yes, okay? So if you sometimes experience accidental loss of urine, so if you kind of have some leaking, if you feel unable to empty your bladder, having to go to the bathroom within a few minutes of just having gone, pain or burning with urination, or difficulty starting or frequent stopping and starting of the urine stream. So if you have any of those, and you might have more than one if you have urinary symptoms. Okay, number four, I often or occasionally have to get up to urinate 2 or more times during the night. Number five, I sometimes have a feeling of increased pelvic pressure or the sensation of my pelvic organs slipping down or falling out. Number six, I have a history of pain in my lower back, hip, groin, or tailbone, or I have had sciatica. Number seven, I sometimes experience one or more of the following bowel symptoms. So again, this one has multiple parts. If you answer yes to any of this, it's a yes for this number seven. Loss of bowel control, feeling unable to completely empty my bowels, straining or pain with a bowel movement, or difficulty initiating a bowel movement. Okay, so again, if you answered yes to one or more of those, that's a yes, just one yes for that particular one. Number eight, I sometimes experience pain or discomfort with sexual activity or intercourse. Number nine, sexual activity increases one or more of my other symptoms. So like if you have back pain, for instance, and you have sex, then it also, like having sex will increase your back pain. Okay, that would be like an example. And then number 10, prolonged sitting increases my symptoms. Okay, so now what you're going to do is add up how many yeses you had of those 10 statements, and you're going to then have a number, right? So basically this questionnaire, how we use it is if you answered yes to 3 or more of those statements, it's 91% likely that you have a pelvic floor issue. Okay, and that might be accompanied by, say, some back pain or hip pain or something like that. But again, if you answered yes to 3 or more, it's really pointing to that you may also have some underlying pelvic floor issues. Or if you don't have back pain, but you answered yes to 3 or more of these, it's really pointing to some pelvic floor issues. First, I just want to tell you that pelvic floor issues are completely treatable, and it can be done conservatively. Okay, it depends on what's going on with you. So the best thing to do is actually get an assessment. And I want to say that these are all of the things that we talked about today, or those kind of signs or symptoms that this questionnaire went over. It's all things that can be treated by a pelvic floor physical therapist. So what I would say is the next best step is to seek out pelvic floor physical therapy. And here at the Healing Spot, what I would recommend is go to our website, healingspotpt.com. Reach out to us. We would love to answer any questions that you have. Request a free discovery session on our website. And we would be happy to sit down with you face to face or via video and answer any questions you have and talk about the concerns that you have. Thank you so much for watching this Ed Talk.